So this session is going to be AI regulation around the globe, developments and their impact on digital health. But to start, raise your hand if you're from the telecom sector. Okay. Raise your hand if you are from a technology business. Okay. Raise your hand if you're a clinician. Okay, that's the biggest number so far. That's interesting. Okay, raise your hand if you work in AI. Good, that's a bigger interest. Okay, great. Come on up, panel, please. So, how we're going to handle this is, we're going to have a quick intro from each panelist to introduce themselves. Then we're going to have some slides from Alberto. And then I will initiate a conversation between us around a range of topics. So first, starting with Alberto, please introduce yourself in 60 seconds. Go.
Happy to be here. Many thanks for the invitation. Alberto Giovanni Busetto. I'm the Chief AI Officer of Health AI. 20 years of experience in artificial intelligence in regulated industries more generally, and in healthcare to a very large extent. I was faculty at the University of California in Santa Barbara in artificial intelligence, and prior to that I studied at the Swiss Federal Institute of Technology in Zurich at ETH. Then I became the first group head of data and AI at Merck, German Merck, the pharmaceutical company, and the group head of data and AI also at the Adecco Group, the large HR and professional services company. Since several years, I'm also a council member of the World Economic Forum and an OECD expert on AI for health. Happy to be here.
Thank you. Ralph?
Hello. Good morning, everyone. My name is Ralph Oyini Mbuna. I'm the Director of Digital Transformation at Smart Africa. It's, I would say it's the most exciting department at Smart Africa, because what we do is like we touch on everything that has to do with digital services and entrepreneurship, the startups and all the services, including digital health. And what Smart Africa is about is an international organization that supports African countries in their social economic development using digital. What we observe is that there is a direct correlation between the level of development of a country and the level of maturity of its digital transformation. All right, we all agree. So we're trying to use that in order to drive development to Africa. Thank you.
Ein, thank you.
Yeah. Good morning again. I have medical training. Treated patients last time in 2004, so mostly my professional life has been bridging between healthcare and IT. I am working with analytics, advanced analytics also since last century, so that I could say that I'm an AI enthusiast also natively, but mostly I work with different healthcare organizations, governments, or technology companies to help them implement technology-intensive innovation. So currently starting a startup and also working with a clinic, and then trying to make my best with the help of ECH Alliance and its network to truly transform healthcare with the help of digital technologies.
Raj.
Thank you. You know, my real intelligence had been corrupted by all the multilateral bodies. I had a chance to work with WHO drafting the first digital health guideline. I chaired the Commonwealth AI Consortium, chaired the UN Committee on Digital Health, been a part of the World Economic Forum Global Agenda Council a decade and a half ago. I'm not an authority, I'm an author. And I also run the Global Digital Health Summit, the Health Parliament, which is a global think tank. We operate in 67 countries. And we also run the Patients Union and the Academy of Digital Health Sciences for those of you who do courses in digital health.
Thank you. Right. So we're very privileged to have a panel of genuine experts from around the world. So we have Africa, India, scale. We have Europe. And then we have Alberto, who actually works globally. So I think we should have some very interesting insights. And they've been warned that the idea is that we do not agree with each other on everything during this panel. So we're going to try and have it a bit spicy too. So I'm going to, at this stage, hand over to Alberto. He's just going to give us a couple of slides to kick off this panel.
Thank you. I'm happy to share with you a little bit some information, the vision, and the priorities of our organization. So our organization is Health AI, the global agency for responsible AI in health. So it is a fairly new organization. Our strategy, in fact, that you will see here has been formulated in late 2023, and we are already in the implementation phase. So as the name highlights, we focus on responsible AI for health, and we define health, of course, in the broadest possible sense, but we're also an organization that is really laser focused on the aspects of health that are regulated now or that will be regulated in the coming years. And we also have a priority focus on use cases in clinical applications because we think they are the most urgent and the most important today. But of course, the broader kind of scope of what we do is also including every step in the value chain of health, from bioprocessing to last mile delivery and anti-counterfeiting. So we are an independent, Geneva-based organization. We are neutral, and we are acknowledging the fact that health is important. It goes without saying. But especially when it comes to AI, there are a number of challenges today. On the one hand, there are regulations that are evolving and changing. Of course, I'm exaggerating, but one could say almost every other week. And we can also expect that these things will change quite much also in the near future. There is a need for global harmonization. That doesn't necessarily mean that every country or every region should do the same things, but a certain level of compatibility or, say, mutual understanding would certainly be beneficial. And of course, it's fair to say that there is no AI today that is not data-driven AI. And so data governance and data management are super important, as well as it is post-market surveillance, which is something that we give for granted, of course, for, let's say, pharmaceutical products or medical devices, but which is, to a large extent, something new when it comes to artificial intelligence, especially in its latest forms. So we like to describe our organization as a bridge. We are a bridge between the normative bodies, for instance, international organizations like the WHO, WIPO, and ISO, and so on, that are setting the global standards. We don't set the global standards ourselves, but we work with organizations that do. And we do the interpretation. And we connect the normative bodies to the regulatory bodies that are indeed validating the AI solutions that are typically at the country level. While we don't do the verification or the authorization ourselves, we work with them to build capacity. And so what it means is to not only facilitate, but also create a community of practice and create the support, including a global repository of authorized AI solutions and an early warning system for post-market surveillance. So these are the 4 pillars of our strategy and implementation. The first one is that of building capacity at the national and regional level. The second one is to build a network and a safe space for regulatory agencies in a broader community that is working together with many of the partners that we even see here in the room to make sure that responsible AI is encouraged and is made possible with all the players, because innovation is always a team effort. We are also building a global early warning system to be able to notify our partners immediately on potential malfunction, unethical use, or even potentially cyber attacks. And then finally, we are building a global public repository of authorized AI solutions, which is important because local innovators, wherever they might be, are typically getting their solutions authorized at the local level, but we want them to shine globally. Thank you.
Great. Okay, so we're going to start off with an easy question. okay? And that easy question is, the US doesn't like to regulate generally on technology and takes the view that regulation impedes innovation rather. And in contrast, the European Union have passed the AI Act in order to ensure that AI is both safe, but also respects the fundamental rights of the European Union. So the question is, to regulate or not? Who wants to start off? Raj.
Yeah, so I very much look at what the global scene is, and being a part of implementing AI at the patient level. Of course, we saw, but US was the first that started regulating, the software as a medical device and all that. Then they had the AI Bill of Rights, which emphasized transparency and patient safety. You had the EU AI Act that says classifies AI system based on risk, so health is high risk. And UK is about balancing innovation and safety. And China is mandating assessments on security. India started with our Digital Data Protection Act. Now the challenge is that the industry that doesn't know where it's going, how do you regulate it? How many of you know 5 levels of AI? Can you raise hands and tell me about that? I saw that you asked question, how many work in AI, right?
Yeah.
No one knows 5 levels of AI.
Right.
And as someone who runs a course on digital health, at each level of AI, I say there is a deployment, there will be displacement. Each level will create models of care. So just imagine if we start regulating, so all their energies go in compliance, that takes time, money, efforts. So I have always believed that an industry that is nascent, do not regulate in the very early on. I mean, the regulators don't understand. In fact, it takes me to Ronald Reagan in 1986. He said, if it moves, tax it. If it keeps moving, regulate it. If it stops moving, subsidize it. So I think on that sense, I would say that let this industry first reach a level of maturity when your regulators start understanding it. So I think I would have a staggered approach to regulation, handhold the industry, work with them, understand it. I would rather say that we should self-regulate it. As players who are developing products, let's self-regulate it. Let's have more of the ethical implementation frameworks, the 3H of AI that we call, helpful, honest, harmless. I think if we do that, we can adopt the US approach of no guardrails for now. But otherwise, where AI is supposed to disrupt through innovation, you are going to disrupt innovation by regulating it. I'm damn against. There's so many agencies sitting here, that talk about we want to regulate AI, but they don't know AI. So my fundamental question, first, let it grow to a stage where you understand it, which will be like 4 or 5 years from now, then think about regulating it.
Good friend Raj. I agree and then I disagree. So first, I was part of the Estonian team who also negotiated GDPR at the time. And I was there on behalf of the health system. And already at that time, I was the guy who disappointed many entrepreneurs and people who said that, oh, GDPR is a bad thing for innovation. And I tend to tell that it's not just the regulation, but also how do you implement it. So you may have a good regulation and then you have people who just apply it in a stupid manner. Some people in Estonia say that there is a tendency that in Estonia we tend to apply the EU rules by German precision, which should not be done. So I don't know about the Germans. I can see this country more or less is doing fine. Now we are all struggling. But back to the point that I do think that if we're regulating hammer as a tool and say that somebody points out that everybody can buy it from a shop and then go and kill their neighbor. So hence it's a bad thing. We should not allow anyone buy a hammer. And yes, every tool, especially new tools, has potential in a bad hands. And there now I come back to where I do agree with you. That it is more about how and what is done with AI than the AI per se. And I hope that we will hear that the health AI actually is fulfilling exactly this task by helping you to understand what you can do and what you should not do, rather than what is good and what is bad.
Maybe I'm going to chip in here.
Yeah.
Yes.
Please do.
I give the view of African stakeholders. Yesterday, I was at a very interesting session by GSMA. I don't know if some of you were there, and they were showing a use case of holo-telesurgery. Very interesting. So they use holographics to do surgery from Singapore to Accra, Ghana. So you have like a surgeon in Singapore and a surgeon in Ghana, and the opening people, it was even very graphics. So my point here is regulation is already happening. Why? It was a pilot, right? But what was going on between those two practitioners is like they were doing ethical reviews. Since Singapore was a little bit more matured, they sent the ethical review to the Ghana surgeon and the Ghana hospital. And if the ethical reviews was validated, that's how they proceeded to the pilot. So companies are already self-regulating. So regulation is happening. The mistake to do is to keep the regulators out of this discussion, because they will regulate either way or not. Regulation make or break a country. Let me say it again. Regulations make or break a country. When you look at Singapore and when you look at some of African countries, I've been around. I'm telling you, the difference is regulation. You want to keep those regulators part of the conversation. You want them to learn. You want them to be close to the private sector. You want them to talk to the surgeons doing like AI in healthcare and understand what companies need, protect people. And then AI would truly, we say we have an estimation, it's done by GSMA. We believe that by 2030, AI will bring $2.9 trillion in the digital economy in Africa. And this can be done with proper regulations. Regulation can make or break a country.
Alberto.
Yeah, happy to contribute and perhaps offer, let's say, an orthogonal perspective, a bit kind of a different perspective. Very often when we see that in the media and in many conversations, including here, we see regulation versus innovation, or perhaps safety versus innovation, as a dilemma. There is obviously some reasonable and understandable tension there, that's clear. And it is also clear that over-regulation suffocates, right, innovation. Perhaps in some cases it is also a false dilemma, in the sense that one thing that might very well happen is that there might be monopolies in terms of data. So data monopolies, AI monopolies, extreme concentration in that sense. So proper governance can allow for fair play, which is an important thing. And because my background is that of an innovator myself, and I'm also a techie at heart, I can see how governments, right, can help innovators. For instance, by setting up AI innovation sandboxes. So regulatory, legal, and also technical environments, so that governments do not only tell innovators what not to do, what is not allowed, but actually proactively help them eliminate barriers and do the right thing. So this is my expectation as an innovator, and I think sandboxes are the way forward.
Well, the privilege of being a moderator is that I'm actually able to articulate my own views. So it will be no surprise to those people who know me and know that I'm a lawyer that I will have a certain view on regulation. So for me, the important thing is that much of the conversation we're having is about trust, okay? And whether it's trust in GDPR, trust in data, or trust in AI. So what we all have to recognize, if that we do not foster that trust at both a patient level, at a clinical level, so doctors and clinicians, then actually AI in healthcare is going to have a really tough start. But also I'm a believer that regulation is not simply about what you cannot do. It's about good regulation, is about enabling innovation. So what I'd say is that we must not look at this through a single lens that says you cannot do X, Y, and Z. But actually what we want is regulation that evolves as we learn by doing and actually is enabling innovation so that we can reach the benefits that it has. So I'm gonna turn us now to a related aspect, which is very much about, and this is the bit that frightens me, okay? So 2 years ago in Health Las Vegas, there were 10 to 12 stands that had AI on the booth. 6 months later at Vive, there was 30. 2 weeks ago when we were at, the ECH Alliance was at Vive, there were 50 plus. So industry is in danger of treating AI as the emperor's new clothes. So what I'm worried about is it over-promising and under-delivering. And what I'm just going to try and turn us to is this whole question of risk. Do we think that we know enough about the risk to manage it now? I know, Raj, that you were basically saying we don't know that yet because we don't know what we don't know. And are we comfortable that it's enough for us to be describing this? I mean, I think, Alberto, your work in terms of educating and informing regulators so they better understand AI is clearly an important jumping off point. But what do we think about this question of risk and risk management?
Can I?
Yeah.
So, you know, there are always two sides of the coin which Ian very clearly explained. So when you look at AI, there are certain things which are quick wins, and health is not any other sector. Trust is not about regulation, and trust is about evidence in support of the good it does. Right? So I think we are harping on the wrong narrative to say that if you regulate, there will be trust. There are so many regulations on pharma, on hospitals, but is there trust? Ask how many people trust healthcare systems in the country. How many don't trust? Can you raise your hands? That's the challenge, you know, that people would not trust of what healthcare will deliver besides consuming the money and the lives many times. So I think it's more about evidence in support of artificial intelligence. I believe there is no straight-cut answers for this, but I can give you some stratified answers, like for lower middle income countries, conversational AI will deliver phenomenal value. They have nothing in certain parts of Africa and India. Now there will be something, 85% accurate, 70% accurate, but there is something. They are not lived on their fate. On certain specialities, dermatology, radiology, probably psychiatry, there are quick wins. And I think you do not have the resources that you will build over the next decade or so. I think as Mike Short said, let's have a strategy. First, let's have where the gaps are. So AI will certainly fill those gaps. So I would say that look at evidence, wait for the evidence to shape up with the scale and scope, and then think of saying, what is high risk for me to regulate? Screening, diagnostics, and treatment are the three levels you look at healthcare, right? I think regulation should also look in that stratified manner. Thank you.
Well, then again, the EU AI regulation explicitly said that each member state, each country must have a sandbox. So that, and if this is an unknown new tool, and I personally believe, the Estonian government believes, few other governments, also US, UK, believe that this will be transformational. But yet we don't know what the transformation will be, so that we can regulate that you can play with this new hammer in an environment which allows you to mitigate against some risks. So once again, it's not either or about regulation, it is then what to regulate. And then of course the question becomes, I had just discussion with my government representatives last week, okay, what that sandbox does. Is it just ticking the box for the commission, or will it lower the barriers, for instance, for different foundational models, different data sets that you can use, different entities to collaborate in that environment, so that it is, as Alberto said, regulatory, data, and technological environment where then these people in the hospitals, I've heard, each of them has in their basement, some AI that they work with. So that instead of allowing them to do things in a manner that they don't know if they are on track, give them the environment and regulate then that if you work there, you're safe, even if you make mistakes, because we're all going to make the mistakes.
Maybe I see time. This is very stressful because time is flying. I will try to be brief here. Last weekend, we had the first African AI Council meeting. That was very interesting what was discussed there with the ministers of ICT. And one thing that was really out for Africa was skills, the skill level when it comes to AI. I have a statistic here that is ridiculous. Only 2% of Africa only represents 2% of the global AI talent pool. 2%. When we know that African population is around 17% of the world population. That tells you how ridiculous it is. I have another statistic. When you look at your smartphones, your devices, it's only 0.02% of African languages that are represented there, right? This is an issue. Why am I mentioning it? Because during the African AI Council, one of the resolutions that you can call a policy, a guideline for a policy that will be now implemented in respective countries, was to do actions, concrete actions to increase the level of skills of AI. That's what regulation can do. It can be, instead of looking at regulation versus innovation, I like to look at it as being responsible and innovate, right? And regulation can act as a safety net for AI practitioners, for digital health practitioners to operate safely, as it was mentioned previously.
I'm a big fan of, evidence-based and formal methodologies, especially in the context of healthcare. So I would like to contribute to this conversation on risk management by highlighting the fact that there are very good frameworks to manage risk. For instance, I would like to mention a couple that I think can be useful also for the audience here. One is AI risk management from the National Institute of Standards in Technology of the US. And the second one is the repository of documented AI risks coming from MIT. Now, as societies, we are facing many different challenges, and it is not obvious how to balance research, safety, how to run the sandboxes. But I think the good news for us is that there are now useful frameworks, including for clinical trials and adaptive trials and Bayesian multi-objective frameworks that would allow us to take this, or at least some aspects of this question, and solve that in a scientific way.
So I think that it's worth remembering, of course, that for healthcare, the mantra is do no harm. And you can't fulfill that mantra unless you actually have evidence. So I think we're all in agreement about the importance of evidence. And the limitations of AI have just been perfectly illustrated by my Apple Watch, which has just sent me a message and vibrating on my wrist telling me your heart rate's over 120. It has no idea that I'm on stage. If it did, it might not have sent me the message. But in the meantime, let's turn our attention to use cases for the last few minutes that we have, and talk about use cases that we've come across as individuals that involve AI and that we think are illustrations of that potential that AI has to transform healthcare.
Yeah, I can see every day how doctors, nurses are afraid of the tool. So that in my mind, and this is again comes from the experience and then also from the evidence, that 40% of the administrative tasks that doctors and nurses are forced to do because they need to document and then codify and send their invoices to the insurance to get paid for their job. This is something that machines can do much better and faster, and also where the kind of fear of doctors and nurses that it will come in between them and the patient, and also that it will somehow create additional risks to the patients are lower. So that introducing AI in the context where the risk is lower, the psychological barriers are lower, but where actually the financial gains are to be achieved fairly quickly. And this is, I believe, the way how we learn to live with these machines. We've had several discussions with many of you that, machines are there. The coffee machine, need to tell what you want, and then it tells you to fill their beans and everything. To get the right, you can't, call and talk to a person. You need to talk to the machines. So I think that's also in the healthcare, that to get over this fear, I think starting from something simple, and then while the evidence is gathering over more sophisticated solutions, I think that's also when we kind of don't fear anymore these new algorithmic friends around us.
So I think we have crossed the stage of talking of use cases, because there are large-scale deployments, and I can tell you, half of us, if we are here, we wouldn't be alive if we wouldn't have used AI during COVID for vaccine development, for repurposed drugs. Just imagine the scale at which AI delivered. Let's be very clear about that. I think I'm working with Ali Parsa, who founded Babylon. Look at his new product called Revia. We have worked on Patients Union, where by end of this year, we will eliminate the need of primary care physicians for common ailments. You don't have to go to primary care physicians. It is so accurate as we are testing it. So I think for any part of the healthcare industry, AI will touch and transform, and I think it's gone above the stage of discussing use cases now, which makes it believe it's like very early, but it has already shown that it can deliver. Thank you.
Yeah, this is very interesting. By the way, I did my PhD in AI like 10 years ago or something like that. So it's fascinating to see what's happening, and I totally agree with colleagues here. We don't know where it's going. We just don't know. Because like 15, 20 years ago, when you look at AI, it was nothing like this. It was still like using mathematical models to take decisions and stuff like that. Now we discovered that data can make it grow faster. So the point that I'm trying to say here is one thing we know. I talked about the use case, the holo telesurgery use case earlier that I assisted with GSMA during one of the sessions. But one thing that we know for sure is AI will not take jobs. AI will not take jobs, but it will replace those who do not use AI. You don't have a choice. We need to learn how to use AI. We need to use AI. Myself, I'm using AI. I'm using like those generative AI every day. You have to use it. Otherwise, like, you'll be obsolete. And I'm not afraid of saying this statement because, like, years back, I would be a little bit skeptical because, like, there will be doubts. But now it's a sure thing.
And from my side, an invitation to pragmatism. Now, in supply chain and manufacturing, AI is undisputedly already incorporated in many processes. We see more and more use cases in radiology, notably, but also cardiology, ophthalmology, and so on and so forth. And by training, I'm a scientist and an engineer, so for me it's natural to think in those terms of baselines and also A/B testing. And that's a good thing. Very often, when we see the new use cases, and also the established ones, we are comparing AI with the best standards, with the gold standards, which is the right thing to do very often. But there are also plenty of places in the world where there is nothing else. And I think this is a big opportunity that we cannot miss. AI is relatively inexpensive, and it would be a pity to miss out, if you will, on opportunity to do a lot of good and for people to benefit. So let's be pragmatic about this.
Okay, so I'm going to wrap up with a couple of roundup statements. So for those startups out there, I'd caution you from using AI as the buzzword, okay? Satisfy yourself that you're not managing, you're satisfying the do no harm test, okay? Secondly, a couple of plugs for the panel. So I'd encourage anybody that's seriously involved in Health AI to look at Health AI's website, get involved with the community of practice, give information about established evidence use cases. And for Raj at the end, he has an initiative called Data First, AI Later, meaning that we need to train AI on quality data that is not biased. So what's really important as well is that we do not overlook the need to clean up health data. And with that, I'm going to say thank you to my panel, and if you'd show your round, give them a round of applause. Thank you.